When you inject botulinum toxin anywhere in the face, dose and technique are very important, but these are particularly important when you're dosing in the lower face, around the mouth and the chin. Here at the Florida Society of Dermatologic Surgeons annual meeting in Orlando, Dr. Doris Hexel gave some tips on injecting around these areas. Now, Dr. Hexel, can you tell me why it's particularly important, the dose, when you're dealing with the lower face versus the upper face?
Well, it's very important to use very effective dose to control the muscles in the upper face. But due to the fact of all the muscles in the lower face are directly or indirectly connect to the mouth, it's very important to play with low doses and always use the lowest effective dose you can for all indications, because you always have the chance to touch up patients later if needed.
So you're saying as the mouth, any changes, any asymmetry would be very obvious around the mouth, obviously.
Exactly, and patients and side effects around the mouth, it's very hard for the patient. So to prevent side effects in the lower face, dose is very important.
Now, this wouldn't be an interview about botulinum toxin if I didn't ask you for your ratio, what you use between Dysport and Botox, and I know you addressed that earlier.
I use the 1 to 2.5 equivalence that may be achieved using 20% more volume in your Dysport presentation of 300 units. And by thinking in this equivalence, people can just use the toxin the same way, especially in the upper face. But I do suggest, do not just compare the published doses for Botox, because if you use 1 to 2.5, this will not have significant more diffusion, but it's more potent. So we should lower the dose, and I prefer to use the 1 to 2 equivalence. In places that I used to use 1 unit of Botox, I'm using 2 units of Dysport, and I'm achieving the similar results.
Okay, so you're happy with the results you're getting at that 1 to 2 ratio?
Of course.
This has been Damian McNamara reporting from Orlando.